I had these little kids coming up to me randomly and just being like, "Be your own
I
you,
was
and I'll be my own me. The freedom to choose is called autonomy." Everywhere I went for the rest of the
Oh,
school year.
A autonomy, B for boundaries, C is for consent. The ABCs of me. My ABCs, my ABCs. Tell you what they
I'm Jennifer Paulino with the Hip Hop Public Health team. And so our conversation is about the ABCs of Me Toolkit that I know that you tried out in your school community. And so for those that are listening, the ABCs is a toolkit to help children learn the skills to develop healthy relationships, the A for autonomy, the B for boundaries, and the C for consent. And so Sarah here will be helping us to unpack these skills and also tell us about her experience using it with her students. So, just to tell you all a little bit more about Sarah, Sarah Thebo has been a school counselor at Valencia Park Elementary School in San Diego for the past 6 years. Before counseling, she was a second grade teacher for San Diego Unified School District. Sarah is also a parent and had the privilege of implementing the ABCs of Me lesson in her daughter's first grade class this school year. So she brings to us her perspective as both a school counselor and as a parent using these lessons and bringing them to life in her school. So, Sarah, if you can tell us from your professional experience, from your time in a school setting, why is teaching skills like autonomy, boundaries, and consent so important today for our children?
I well, to start, first of all, thank you for inviting me to
Of
have this
course.
conversation. To start, I specifically implemented the ABCs of Me with our kindergarten and first grade students because one of the needs that we were seeing specifically with this group was they didn't understand the concept of just keeping their hands and feet to themselves. Just constant touching other kids, some inappropriate touching in there as well. In previous years, I would do a lesson that I call good touch, bad touch, which just very clearly, explicitly states, okay, this type of touch is welcome touch, and this type of touch is unwelcome touch. And a touch that makes somebody feel uncomfortable is essentially unwelcome touch. But I just felt like that scratched the surface of the conversations that needed to be had. And so when I heard about the ABCs of Me and hip hop public health, and I saw the curriculum, I went, wow, this is so much more engaging, first of all.
Mm,
And second of all, I felt like it went a lot more into depth with topics that needed to be addressed, like the concept of autonomy. And we each have our own body and we each have the right to our own body. That I feel like is a framework for all the other discussions that I was trying to have with kids. Boundaries, if you hear a no, just let it go. That is something that kids need to hear. They need to hear that it's okay to hear the word no, and it's okay to walk away if someone says no. And you're allowed to say no too. And consent, asking permission before we do something. Again, I feel like all these pieces, yes, good touch, bad touch, great, important, explicit, but it does only scratch the surface. And I felt like the ABCs of Me really went a lot deeper than just that surface level and gave me the opportunity to have conversations beyond just one specific type. I would say our kids after the program really seemed more empowered to be willing to say, hey, that's not okay, or hey, no, thank you. Um, and we did see a reduction in kids keeping or in kids touching other kids. And we did see more kids self advocating for themselves. I really feel like we built some really solid classroom communities where kids were not only advocating for themselves, but they were advocating for each other too. So what we found was there were maybe one or two outliers in each class who really, really struggled with keeping their hands and feet to themselves. And before, what we noticed is these kids were kind of just getting away with it. Whereas
Mm.
after, we noticed kids were advocating for each other, where they would see this one outlier going up and constantly putting hands on other kids. And the kids would actually say, um, if you hear a no, just let it go. Or, they would say, hey, you need to ask first before touching. So there was just a lot of empowerment that I feel like came from the program.
What in particular do you feel stood out to the kids or that really resonated with them?
I think in my community in particular, we have a very multiculturally diverse community. And so just the fact that the ABCs of Me was it very specifically um, sought to represent a variety of different student groups. I feel
Mm.
like that in itself resonated for a lot of my students, where they saw themselves in these characters who were talking about, standing up for themselves and advocacy. And that alone, I feel like, was empowering in and of itself. But just the language and the coaching of, what to say and how to
Mhm.
respond in situations, that also really helped a lot too. We've definitely made progress where some kids were asking, is it okay if I give you a hug? Or I um is it okay if I take you over here, put my hand on your shoulder? We always go over whatever the song of the week is, whether it be the autonomy song, the boundaries song, or the consent song. The
Mhm.
kids really look forward to that. They have to have the song.
Oh.
We can't do the lesson without the song each week.
And they're singing
And
along. Do they learn
and
the words?
they're trying to learn the words as best as they
Aw.
can, but I mean, each song has its own rap to go with
Mhm.
it, and they can't quite keep up with the changes. But they're trying. Then we do like a quick little activity that comes with the lesson. It's usually kind of like a choose this option or do this movement if you agree with this, or do that movement, or go to that side of the room. So there's a lot of movement in there, which I love. A little bit of repetition in there with learning some different chants, which is
Mhm.
awesome. I kept the lesson short. I would schedule 15-minute blocks with each class. And the reality is, a lot of the lessons only took maybe between 10 and 12 minutes. Sometimes, if the class is more chatty, we'd be pushing that 15-minute time. But for the
Mhm.
most part, within 12 minutes, we would be done each week. I will say I am horrible at following multi step directions. Um, Lesson plans, a lot of the times, are daunting for me because that requires
Mhm.
me to actually like read this extensive page.
And follow the sequence. Yeah.
Uh huh. And to try and like learn all this dialogue where I'm not sounding like a robot as I'm trying to just go through
Uh-huh.
all of the scripting beforehand.
Yeah.
Yeah,
Yeah.
I anything that seems scripted to me, I pretty much don't follow very well. But I felt like with this program, I didn't have to be super scripted. I had the
Mm.
freedom to follow the slides, but also have that freedom to, in real time, address things that were happening in the classroom. So it felt very relevant. So I
And
didn't have to follow this extensive script. It wasn't something I had to prep way in advance for. Um, it's
yeah.
actually really easy to follow. So that would just be my recommendation, or my thought for any teacher who's thinking that this is going to be this huge time commitment. It's like 12 minutes at most a week,
Mhm.
and um, it is really easy to follow.
What is the main message you would want educators to take away from your experience?
I think just be brave, have
Mm.
these brave conversations with kids. And I definitely think Hip Hop Public Health is here to make it easier.
What is the key message that you would want your daughter to take away from these skills and these lessons.
Yeah, I mean, I want her to know she has control of her body. I want her to not be afraid to speak up if there's something that she doesn't like, and that's what we want for all of our kids. I would definitely just encourage anyone who's just looking for something fresh and something that is engaging. I would really encourage this program for sure.
My ABCs, tell you what they mean.